everyone, my name is Kristen and welcome to my YouTube channel. I'm currently in my third semester of nursing school, and if you don't already know, I am hosting a giveaway right now, so if you're interested and would like to sign up to win a 1 year's free subscription to the application called Nursing Central, I will go ahead and just link the video right here. Now the nice thing is that application is yours even after the subscription ends, and I think it's super beneficial if you want to have these resources throughout your nursing journey. Now for today's video, I did want to talk all about nursing diagnoses and how to concept map. So if you're interested in today's video, just go ahead and keep watching. So you're probably wondering, what is a nursing diagnosis? What is a NANDA? These are the few things that you need to know to be able to start your concept map. Your school might call it just something a little bit different. I'm not 100% sure, but my school, we call them NANDAs. So NANDA just stands for the North American Nursing Diagnoses Association, and they actually come up with a list of problems that a patient could experience. And this problem list is actually more important than you think it is, just because we do like to go ahead and assign a problem to a patient whenever they are experiencing a certain health condition. Now, when we think of NANDAs, they are actually pretty important because this is how a nurse bases their overall care that they're going to provide for that patient. So when we pick a problem that we decide to give a patient, this is how we are going to decide what interventions that patient receives, as well as the goals and outcomes that we want to see that patient achieve. So NANDAs are actually pretty important, and whenever I have to do concept maps, I always have to assign a NANDA to a patient. So hopefully giving you a small overview on the different types of NANDAs that I know about might be helpful for you in case you are struggling a little bit with concept maps. But definitely, I do want to say, don't be hard on yourself when you're first learning about NANDAs. They are a little bit tricky and a little bit confusing to understand at first. So just keep practicing, and whenever you can, look up nurselabs.com. That website has some amazing care plans that you can look at for some advice or maybe just some help in case you're struggling with assigning a NANDA. And I am going to go ahead and link this book right here. This book is actually assigned to me by my school, so it is required, but I utilize this textbook. And honestly, I love how the textbook is laid out. I can just go ahead and search a health condition by the first letter and the name of the health condition, and every NANDA that is possibly related to that specific health condition is listed there, so it makes narrowing down what NANDA I need to pick for that patient a little bit easier. So in my nursing program, I actually learned 3 different types of nursing diagnoses. So when I talk about a problem-related nursing diagnosis, this one has 3 steps. So you essentially talk about the problem that the patient is experiencing, and then you will go into as related to, which discusses the etiology or the cause, and then you'll discuss as evidenced by, which is actually the signs and symptoms that the patient is experiencing. Then you might also talk about potential nursing diagnoses, which are more the at risk. So sometimes you'll experience in the hospital or in a case study that your patient is not technically experiencing a physical problem, but they could be at risk for that problem. So in an at-risk nursing diagnosis, you really just talk about the potential problem that the patient could experience in the future, and then you'll talk about the cause that's related to that issue. And the last type of NANDA that I learned about was actually the health promotional NANDA. Now, this NANDA is a little bit different. So when we're talking about health promotion, we're really trying our best to make sure that we're promoting the best health that we can within a patient. We're preventing disease, and we're also trying to shy away from a premature death from that patient. So a good example that I can think of whenever we're talking about health promotional NANDAs, let's say that somebody is ready to go ahead and improve their self-care. I know a NANDA off the top of my head is readiness for enhanced self-care, and essentially when we're giving health promotional nursing diagnoses, we only have to use the as evidenced by. So in this case, I would go ahead and support my NANDA that I decided to choose using the as evidenced by or the signs and symptoms that the patient expressed to me. So for this example, you could use a direct quote that the patient may have stated, but health promotional NANDAs are not ones that I technically go for just because my professors do like for us to stay with the more problem focused, because we want to currently work on that problem that the patient is experiencing right now. Now, if my patient is relatively healthy, there have been times in clinicals where I have given my patient an at-risk NANDA, but like I said, my professors do like me to stick with problem-focused and stay away from the other two. All right, now when it comes to concept mapping, I do just quickly want to say, after this, I'm going to be going through a full example with you and showing you my screen as I go through it. For my OB clinical rotation, I do have to go over sexually transmitted diseases and infections, and I was assigned gonorrhea. So I have to learn all about gonorrhea and the different signs and symptoms, how it could not only affect the mom, but how it can affect the baby as well. So that's the concept map that I'm going to be working on if you're interested and want to see how I break down my concept map and how I go through it. So when it comes to concept mapping, I quickly just want to state that I do have a blank concept map that I am going to talk you through just so you can get a better idea of the information that's most important for you to know. But whenever you are doing a concept map, these are just there for you to be able to understand what the patient is experiencing, what their symptoms are, maybe some clues to help you figure out how to give the best care possible, and then really help you dive in on the best interventions you can give that patient. So whenever we're talking about NANDAs and concept maps, these tools are just there for you as part of the nursing process to be able to critically think through how to give the best care to a patient. So whenever we're talking about a concept map, you could be putting a concept map together based off of a case study, based off of simulations that you have previously gone through. When you're in clinical, whenever I'm in clinical, I always have to do a concept map on a patient, and that is just for my benefit as a student. Yes, they can get a little bit redundant and a little bit time consuming, but I find them very useful because it's easy for me to organize the information and see exactly what I'm working with. So whenever we're thinking of a concept map, we're really thinking holistically. We want to make sure that we take everything into account in a patient's care because one, that is going to provide the patient with the best care, and also it's going to make the patient want to participate in their care as well. Because we're including the patient, we're including their values, we're including their beliefs, and we're just making sure that they're our number one priority, which sometimes I feel like the healthcare system has gone away from that holistic approach, which is one reason why I chose nursing, just because I want to look at the patient as a whole, and I want to make sure that I take every aspect of that patient into account to make sure that I can provide the care that the patient would want. Now, the specific example for the blank concept map that I have was actually given to me by my med-surg clinical instructor. So I'm quickly just going to show you the blank concept map that I have. Now, I am going to go through each of the points on here and talk about what is on this concept map and just some important items that you should highlight whenever you are creating a concept map. In the middle of this concept map, we do have the patient's initials, the age, the gender, and their admitting diagnosis or the reason that they need health care. So if you're like me and you're at clinical and you're filling one of these out, most of the time this is going to be the admitting diagnoses. So why did they come to the hospital in the first place? What was the need for care? And many times your admitting diagnoses is where your first and most important NANDA will come from. Next, we have objective data and subjective data. So I know that might be a little bit confusing, but we do separate out, at least for my school, objective and subjective data. When we're talking about objective data, we're talking about information that you've collected from the patient that is observable as well as measurable, like vital signs. So anything that you may have seen upon general inspection, whenever you're doing like a head to toe assessment, or the vital signs that you got from the patient. So when we're talking about subjective data, this is from the patient's viewpoint. So this is anything like pain. Well, we can't really observe how much pain a patient is in, and we don't really know like the patient's past medical history or anything like that. So all that information comes from the patient's viewpoint. So we really do like to distinguish the two from each other. Now, I do have a section listed in here, labs and diagnostic tests, just because many times the care that you're providing from your patient is going to be dependent on their lab values, especially when they have health conditions, when they're most at risk for electrolyte imbalances, We know that potassium can be very detrimental on a patient's health. I know every time there's a potassium issue, I already know that that patient's gonna be at risk for dysrhythmias. So we're really worried about their cardiac function, and we constantly need to be looking back at the lab values, even if they're normal, because at any point in time, if a patient's lab values go out of the normal range, then we know something is wrong and we need to make sure that we fix that problem. Now, when it comes to diagnostic tests, this could be important whenever a patient undergoes a specific test that needs to be done. So I'm just gonna say, if I'm continuing on with my electrolyte imbalance example, if a patient needs to have an EKG done because we're scared that now that they're at risk for dysrhythmias, I now will put in the results of their EKG right in the little bubble that I have specifically for diagnostic tests. Now, some other important information that I would need to know for my concept map is any past medical history that the patient has experienced. So this is all their past medical conditions, maybe past surgeries they've undergone. Sometimes their past surgeries can also determine what kind of care they get, because this could cause them to be at more risk for something in the future. And I could go way into detail with that, so I'm just trying to keep it very basic. And then we also want to know their current health problems that they're currently experiencing, because once again, that could really determine what kind of care I would give my patient. And the last thing I would need to know essentially is, what are their family and cultural needs? Some examples that I can think about is, do they live alone? Do they have a spouse? Do they have children that help them? What are their cultural needs? We do know that we have to be respectful to different religious choices, and we just really need to understand the patient as a whole. And the last couple items on here are just assigning my patient some nursing diagnoses, so I can go ahead and assign the patient goals that I would like for them to achieve, interventions I would like to give the patient while they're either in the hospital or the next time I see them at a doctor's appointment. And I also want to evaluate the patient to make sure that the interventions that I'm implementing are helping the patient, and to make sure that they're reaching the goal and they're reaching their outcome. So my clinical instructor wanted my first NANDA to be the #1 priority that I was going to focus on for that patient, followed by 2 other health issues that the patient might be experiencing as well. And if I could only think of one NANDA at that time, like I said, I would choose an at-risk NANDA, because everybody in the hospital, unfortunately, is at risk for something. So you can always think of an at-risk for a patient as well. Now, I quickly just want to add in, whenever you are putting together a concept map, it will be super beneficial to get yourself some report sheets. There are all different kinds of report sheets out there. This is the one I've been using when I've been assigned one patient, just because there is so much room to write any information that I need to fill in my concept map. A lot of the times whenever I'm at clinical and I've been given report on my patient, I will go ahead and write in anything that I need to know about that patient. Now, this report sheet is so nice because it literally breaks it down by the different organ systems. The other things that are on this report sheet that I really do love is they have the time right here. So every hour on the hour, whenever I go see my patient, I can go ahead and just write down things that I've noticed. Maybe when I go in for my full head to toe assessment, I can go ahead and utilize that area for things I'm concerned about. Or, if they ask me a question and I don't know, I have that room to go ahead and write that down to be able to get their questions answered. So let's go ahead and dive into the assignment that I have. This is the concept map that I am working on for my OB clinical. Now, this one is a little bit different. Now, it's different in the sense of it is just an overall primary problem or medical diagnosis, so I'm not specifically gearing it towards a patient or a virtual patient. So I am just doing an overall view of the medical diagnosis of gonorrhea. And I am actually doing a presentation on this for my clinical group. So my professor wants me to know the patho, what are some risk factors, the signs and symptoms, what diagnostic tests are there, what are the treatment options, what medications will be used, what are the NANDAs, as well as the nursing interventions. Now, I also do have to talk about different complications that could arise if infected with gonorrhea. And complications can also include complications from taking medications, as well as complications just from treatment in general. So I'm gonna go ahead and get started on this, and then I'm gonna show you how I use my NANDA book, as well as where I'm getting the information from to fill out my concept map. This is the nursing diagnosis handbook that I use, and I just have a PDF document of this book. I am scrolling down to the G section just so I can find gonorrhea, and I am just going to click on gonorrhea, and all of the NANDAs that are associated with gonorrhea pop up as well. So I'm quickly just gonna type these out. Now I would put this in my nursing diagnosis area, but just so it's easier for you to see me type them out, I am just going to type them out on a separate page. Now, once I'm done typing out the information specifically for gonorrhea, I am actually going to click on the part where it says CSTD, and I'm actually going to get those NANDAs as well, because these NANDAs are specifically just for gonorrhea, but there are possibly other NANDAs that I can use that are specifically related to STDs, so I'm going to include those as well. All right, so this is like a rough draft of my concept map that I'm going to turn in. Now, I don't have to actually submit this for another week and a half, so I really just wanted to get a good basis of kind of how I wanted to do my presentation, and I think this is definitely a good start. Now, I went through and I just made some short little notes. I got information from my textbook for my specific class, as well as I used the diseases and disorders section in the Nursing Central app to get most of the information that I plugged into my concept map. Now, most of this is just researching the information and plugging it right in. If you were working with patients, obviously you would utilize the section, the nursing interventions. You would actually be utilizing this section and providing that care to that patient. Now, if I was working with a real patient in front of me, I would obviously want to utilize the sections on my concept map that I talked about earlier. I would want to put in the information about family, cultural needs, as well as any past medical history, what their lab values are, any diagnostic tests they're going through, and then get the patient's perspective on their own subjective data. Now, I really quickly want to say, when it comes to picking a nursing diagnosis, the few options that I have in front of me under the NANDA section, like I said, I would pick the one that best fits the patient's personal needs right now, because every NANDA has their own interventions that I could choose from. So I would want to make sure that I go in the book and I look at all the different interventions and make sure that those interventions fit the need of the patient. Now, I am just scrolling down to just show you, I do have my newborn section separated out. So whenever I do go through my presentation, I can talk about how this specific STI affects not only the mom, but newborns as well. All right, everybody, that is all the information that I have for you today on NANDAs and report sheets and concept maps. I really hope you found this video helpful. If you did find this video helpful, please give this video a thumbs up and don't forget to subscribe. And of course, I do just want to say good luck to you on your nursing journey.